Well, prescription medications can and do improve lives every day of the week, but if close attention isn't paid to the dosage or potential interactions with other drugs, even those bought over the counter can become dangerous and cause unwanted side effects. Medication advice company Health Corporation says these sorts of issues are so common, 1 in every 3 patients they looked at from a sample of more than 21,000 had one. They've devised a pharmacy consultation system called Chemconsult, which is aimed at detecting and preventing these issues. And they say it could help save the healthcare system millions each year. The company's CEO, Ken Lee, joins me now in the studio. Ken, thanks so much for your time. Interesting topic. So what sort of adverse outcomes are we talking about when people have prescription-based medication issues?
We're talking about things like dosage issues, we're talking about side effect issues, we're talking about interactions between the drugs themselves. They're the 3 main sort of categories that we've picked up in our study.
Interesting, because we had Kos Sklavos, who's head of the Pharmacy Guild of Australia, came in on Health Report just a little while ago. He's of the view that pharmacists can really expand their role and help alleviate this increasing burden on the healthcare system. Is this really part of that move?
Exactly. We've devised a program a number of years ago now, and it's been active through the health information pharmacy chain for about a year online, and it's shown now that pharmacists can detect and prevent medication errors from happening on a day-to-day basis. So that's essentially what we're doing through the program.
So Ken, just from a personal point of view, you're a pharmacist yourself. You would have seen issues slipping through the cracks?
Certainly. One of the reasons why I started the program was when I was practicing there was a prescription for a medication for a 9-year-old child, and it was for a sleeping tablet, and it was accidentally prescribed, and that would have killed the 9-year-old child. And we picked that issue up through Chemconsult, and ever since I've picked that program, that issue up, I've wanted to expand the program.
It's frightening, isn't it, when you hear things like that? Now, in your consultations so far of almost 22,000 people, you found that almost 30% were actually taking incorrect doses, which I think is a staggering number. Now, we've actually got a chart to bring up which shows some of the other common problems you found. Can you run through those with us? I mean, the incorrect doses issue is enormous.
The incorrect dosing issue, you've got to remember, it's also what we call suboptimal dosing, so lower than required dose, and also obviously the overdosing side of things. That was certainly the highest number. Then second to that was drug interactions, at about 5.5% of all consults performed. So
is that because of inadvertently drugs being mixed, or because the person hadn't been tested to see whether they'd have a reaction to a particular kind of drug?
Inadvertent drugs being mixed, yes. The thing to remember, though, with the Chemconsult program is that it can prevent these issues from happening. So we now have a system to not just detect them, but to prevent them from happening actively.
What were some of the other medication issues that you came up with there?
Medication issues with wrongly taking food, and some medications you really need to take after food, some before. Simple example, non-steroidal anti-inflammatory drugs. If you don't take it after food, it can cause ulceration, things like that. So very common.
And is this often because people don't ask their GPs, or they're not told? I mean, whose responsibility is it?
It's the responsibility of all stakeholders. So the consumer, the pharmacist, the GP, all healthcare providers really play a role in this. So we really see that pharmacists can step up a little bit more in what they're doing and prevent these sorts of issues from happening.
It can be just something minor too, can't it, Ken, like taking the medication at the wrong time of day?
Sure. There's lots of minor issues which, you sort of think they're minor, but the implication for the patient can be very serious. Yeah.
And of course, some of these mistakes that happen inadvertently mean that people can end up in hospital and in a very dangerous situation.
Certainly. There was a report done in 2001, going back a while now, but saying that there was 140,000 hospital admissions due to medication errors, and What our program has shown is that implementing Chemconsult could free up anywhere up to 1 million bed days a year and save the healthcare system up to $1.8 billion in savings. So we really feel it's an important program to get out there in the community and for consumers to ask their pharmacists to perform the program.
So just explain how this consultation system actually works.
It's a very simple system. When a patient presents with a prescription, the pharmacist uses his knowledge, uses the program and drug information in a combined way to detect any issues. Then if it's a dosing issue, he'll often ring the doctor and make a change, or advise the patient if it's a drug interaction on how to handle that situation.
Do you think it's something that all pharmacists would be willing to take on? Because I imagine it can be a fairly time-intensive process.
It's interesting. The process only takes about 3 to 5 minutes, would you believe, in normal practice. It's because pharmacists actually have the knowledge and are sort of counselling patients on a day-to-day basis. It's really just streamlining that process, and we've made the program very simple to use after 3 or 4 years now of active in-field use.
All right, we're going to have to leave it there. Ken Lee from Chemconsult, thank you so much for your time. Appreciate it.
It's a pleasure.